Years, flu cases have risen across the state and the country, but so have the number of pneumonia cases.
That's right. Pneumonia is one of the most common flu-related complications, and if left untreated, could be dangerous. Roland Rodriguez joins us live this morning from Doctors Regional Hospital. So, Roland, what should people do to avoid getting the pneumonia?
Good morning, guys, and good morning, South Texas. A couple of ways you can help fight or prevent pneumonia. One is get your vaccinations. Get your vaccination for flu and pneumonia. Second, simple as frequently washing your hands.
Rate of 80, O2 sat of 99.
Whenever you have the flu, it affects your body and allows for a superinfection of bacterial pneumonia to cause more health problems.
Pneumonia may be as simple as, you get better on your own without any type of intervention, or you see your regular doctor in the office and they're able to give you some medications and you feel better. But on the other side of the spectrum, it may be as bad as you're having breathing difficulty and you may need to be on the breathing machine.
Most healthy people can fight off pneumonia, but for the young, old, and frail, this disease can be tough to battle.
I mean, if you are to the point where you're not getting better and whatever is going on inside your respiratory system is not being treated appropriately, then it could get to the point where you develop respiratory distress and you develop sepsis. And like I said, we're on the breathing machine and we're really in big trouble.
Many of the symptoms of pneumonia mimic those of a cold or the flu. So how do you tell the difference?
I would really look for any type of respiratory issues in someone who's otherwise frail, has other medical conditions. If you already have COPD or asthma or other types of immunocompromised conditions, then you should really be more cognizant when you develop respiratory issues and fevers, especially if you've already been on treatment for some type of respiratory illness recently and you're just not getting better. That's when we really need to escalate the care.
Again, a couple of ways to help prevent pneumonia is get your vaccinations and wash your hands frequently. Ashley?